Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system, then take actions to try and make a better system for all of us. Down below in the YouTube description box is a link to the Healthcare Advocacy newsletter. You can go there, subscribe for free, have these newsletters delivered to your inbox almost every day. It is the text for the video. All of the background material, all of the references, all of the actions, medical reports, all of that is in the newsletter. So we're fully backed up. Anyway, I want to talk about cancer in the United States. It's a serious problem. About 9.7% of the adult population of the United States currently has some form of cancer. This is 2025. That's about 25.2 million adults. Each year, the number of new diagnoses rises. In 2021, it was about 1.77 million new cases. In 2022, 1.9 million. This year, it's expected to be about 2 million new cases. About 3.28 million people die in the US in 1 year, and cancer will kill about 611,000 in 2024 when the numbers come in. Said differently, cancer is responsible for about 18.6% of all deaths. The cost of health care for cancer patients can vary dramatically, but not small. NBC News recently documented the case of a middle-aged maintenance worker who was diagnosed with stomach cancer. Now, chemotherapy would, in the short term, have helped. But there was a treatment combining chemotherapy and surgery that was available to likely cure him, not just halt the cancer. His doctor submitted a pre-authorization request to the patient's insurer, and the insurance company said no, they wouldn't pay for it. The doctor continued to submit appeals one after another, and they were all denied, until the patient, who was in his 40s, died. He left behind a wife and 3 children. Blue Cross of Illinois was responsible for this man's death. Last year, 17% of Americans reported that their insurance company denied coverage for care recommended by their physician. This is according to a survey conducted by the Commonwealth Fund, a nonprofit that supports research on healthcare issues. More than half of the respondents said that their doctor did not challenge the insurer's denial. One of the cases mentioned in the NBC report was a young woman with cancer who needed a PET scan. Now, of course, insurance denied the request. It wasn't an oncologist or anyone familiar with her case who denied it. It was an OBGYN who was busy denying prior authorizations so the insurance company could hold on to more of their money longer. Other families desperate to find care for a loved one often go into debt. Nearly a third of working-age American adults reported having medical or dental debt last year, 2023, I believe, according to the Commonwealth survey. Academic research shows that cancer patients are directly and disproportionately harmed by health insurers' care denials and authorization delays. A 2022 member survey conducted by the American Society of Clinical Oncology, that's a network of 50,000 cancer professionals, found 42% of prior authorizations were delayed by more than a business day, and that 14% of the delays resulted in a serious adverse event for the patient. The oncologists described the serious adverse event as delay of treatment, 96% of the time, denial of treatment, 87% of the time, disease progression, 80% of the time, loss of life, get this, 36% of the time. This is insurance companies killing people. A study published last year in the Journal of the American Medical Association Network, publication of the Journal of the American Medical Association, found 22% of cancer patients did not receive the care their doctors prescribed because of authorization delays or denials. Researchers found that delays and other prior authorization problems extend to combination drugs used to combat cancer. They include non-specialty drugs which treat diseases affecting large populations, and specialty drugs, which treat complex or rare conditions. The number of non-specialty branded oncology drugs that required prior approvals rose from 16% in 2010 to 78% in 2020, according to a report in 2023 in the Journal of the American Medical Association Network. During the same period, specialty branded oncology drugs requiring prior authorization rose from 73% to 93%. This is a problem that universal health care can fix. People complain that they don't want the government deciding what care they can or cannot receive. But have a look. Commercial, highly profitable insurance companies have an opaque window about what they'll pay for and what they won't. You have no idea until it is too late. You need the care and they just deny it. I mean, really too late. It's either premature death for you or bankruptcy. What part of this is acceptable? The answer is none of it. So let's summarize. Private insurance companies are in the business of making money for their shareholders and executives who are paid millions of dollars a year. To hold on to the money they have and refuse to pay for care is one way they keep more money. If death results and orphans children, well, that's the cost of doing business. A really profitable business, by the way. Let's remind those that can fix this situation that we want it fixed. We need to contact our elected representatives because this situation is out of hand. Now, you can call or email your member of Congress and your senators and let them know you've had enough of people denying care to the really ill and just to build up profit margins. There is a link in the YouTube description box and in the newsletter so you can get their phone numbers or emails. Or on your cell phone, send a text message to 50409. The message is sign, SIGN, space, PAIMTN. Sign, PAIMTN. Here's the message that you'll be sending. I'm your constituent, and I want you to know that commercial health insurance companies don't have your constituents' best interests at heart. Here's what I learned from an NBC analysis of denials of payment for treatment for cancer patients. First, you should know that 2 million people are diagnosed with cancer yearly, and it kills more than 600,000 every year. A 2022 member survey conducted by the American Society of Clinical Oncology, a network of 50,000 cancer professionals, found 42% of prior authorizations were delayed by more than a day, and 14% of the delays resulted in a serious adverse event for the patient. The oncologist described those adverse events, as delay of treatment almost always, 96% of the time, denying treatment 87%, disease progression 80%, and 36% of the time the patient is dead. A study published last year in the Journal of the American Medical Association Network found that 22% of cancer patients did not receive the care their doctors prescribed because of authorization delays or outright denials. The result is that you can go bankrupt or you can just die. Is that what you want? It's not what I want, because they need to feed the machine that generates cash by denying treatment and keeping premiums. That's what they're doing. There is no transparency on what is or isn't covered in insurance, but there is with universal health care. The system is busy creating widows and widowers and orphans to generate cash, and I want you to fix it. I want you to get universal health care up for a vote. According to a National Institute of Health report, 62% of Americans want universal health care. Just do what your constituents want. Thank you. Below, at the bottom of the email, are all of the hyperlinks to the references I described. I would recommend send this action to your members of Congress and your senators. This one is really important. Down below, you can like, share, and subscribe. You can send me comments here or at healthcareadvocacy1@gmail.com. Have a good evening.